Abhijit Sarbadhikary, orthopedic surgeon attached to Neotia, Mediplus, Rawdon Street. I'll be giving a short talk about osteoarthritis, the most prevalent orthopedic condition nowadays, and the ways of understanding it and kind of methods of preventing it, because about nearly everybody is going to be suffering from this at one stage in his life or her life, and that can cause a tremendous amount of suffering and also a tremendous amount of hardship and expenses. But if you understand that, you start thinking about ways of preventing it at a certain age, you can very well prevent a lot of the problems. The thing is, the very simple thing is, it is easier to understand for people who have, let's say, I'm saying it in fun, if you have a chicken piece, think of a chicken piece, whatever is called a tangri, and people who are vegetarians can imagine it thinking about any kind of a shape of or machinery where there is a friction. So think of two things, we are undergoing friction. So even if a ball bearing situation, any kind of mechanical thing, if there is going to be friction, there is going to be, after all, some amount of sediment that's coming out of that friction. So think of a chicken leg, and if you remember, the people who have chicken, is the bone does not end in bone. It ends in a very, very, very smooth surface called cartilage. So if you go on, rubbing this, and you have to, obviously you're walking, talking, and then you're going upstairs, sitting cross-legged, sitting, in squatting position, getting up, and all sorts of situations, there is a lot of amount of friction. And that powder that is coming out of it is called debris, the French word debris. There's no S in it, debris. Debris is like some kind of a chura, some kind of a powder that's coming out. Now, I'll go into a different situation. Let's think that we're going talking about an eye. Now, some powder, or smoke or something falls into your eye. What happens? It becomes red, produces a lot of water because it wants to kind of eliminate that thing, the foreign material. The same thing happens in the knee also. When there is a lot of friction here, then what happens is that there is an amount of fluid that is, produced in the knee to kind of try to wash it. And the soft tissues around the knee joint, they get a little inflamed. It's called synovial tissue. So there is synovial thickening and synovial effusion. But because it's a closed thing, it doesn't go away. What it does is cause a swelling of the knee joint. When the swelling, there is not a very big swelling that can be, easily pertained from the outside, but there is a swelling. Now, if there is a swelling, all the muscles that hold the knee together, they get a little weakened. If they get a little weakened, their resistance to friction gets low. So that next time anything happens, because of that swollen state, there is more friction coming on. There is more and more friction. The more and more friction will produce more and more of that powder or debris. That will cause more and more swelling or synovial effusion. So it's a vicious cycle. So what happens, ultimately the cartilage, the smooth surface, will be gone, and there will be islands where the bone is exposed to the bone on the opposite side. There is no cartilage, there is no smoothness inside. That causes severe pain, and that would ultimately lead to a change of the cartilage on both sides, which is total knee replacement. Apart from the dangers and expenses, you can prevent it. How? There are three ways of, this is osteoarthritis knee. Now, how can you prevent it? It's going by, three things. One is the anti-inflammatory drugs, more and more modern nowadays coming up, which decrease the speed of the degeneration of that debris formation. So that is, I'll give them, let's say, to make it a little fun. Let's out of 10, I'll give this mode of treatment 1.5. Now, second thing is associated factors. If you are very big, weight is quite a lot, and then you have thyroid problems, if you have diabetic problems, if uric acid is there, which produces its own crystals. So there are so many other associated factors that if you have to treat it very well, then you have to identify those associated factors and get rid of them. Get rid of diabetes, get rid of uric acid, get rid of thyroid problems, and weight, which is very, very important. So these are another kind of factors which are prevention and treatment of associated factors. To go on with that fun part, let's give it 1.5 numbers. So 1.5 number, 1.5 number, 3 numbers I am giving out of 10 in the treatment mode. So what is the rest of the 10 the 7? What is that 7? 7 is you produce the weakened muscles, you strengthen those muscles. If you strengthen the muscle, the amount of friction is going to go down. And the amount of friction go down, that will produce a protective, armature against this degeneration. So there are methods of muscles which have to be kept okay all the time, and it's a completely pain-free, expense-free thing. But you also have to go on with this, some kind of a discipline about it. And what do you do about it to, increase the muscles strength? Certain exercises which will be told to you. It's very simple. You can get it in YouTube. You can get it from anywhere, from any physiotherapist properly. So again I'm saying the best part of the treatment is completely free, which is when you know that you're tending to get this osteoarthritis, knee pain, you reduce your weight, you get certain things okay if they say they are not alright, and if things progress, then you start having those But the crux of the matter is developing your own muscles to prevent osteoarthritis. Thanking you for your patience. The thing is, this is something might be new to you. Listen to it repeatedly, and if there are queries, you can always contact us at Neotia.